Good morning, everybody. Thanks for joining us for our monthly webinar. It's our last one for 2025. It's kind of crazy to think about that. Um, so I'll give, it's actually right at 9 o'clock. So we don't need to give people any more time to get in. Just join us when you can. Some housekeeping things. If you have questions, please post them in the sidebar under the Q&A box, and I will be happy to answer whatever questions you have as the webinar flows through. So this is the first time I've done an approach like this. What I wanted to do was take everything that we've talked about this year and sort of summarize it as it applies to complex kids. So we're going to talk about the fact that kids who are complex get better, right? And we're going to talk about the commonalities that I see in their chemistry after doing this for many, many years. I've been working with complex a really long time. So when you come to Covenant, there are just some core principles that we function from. So we believe that there are no bad kids. No matter what their behavior looks like, they're not bad kids. There are no purposeless behaviors. So the things that they do are giving us clues about their health, about their nervous system, about pain, about, anything. So many things are medical with these kids. We believe that you should test, not guess. So we rely heavily on labs, which are actually pretty easy for most kids to do. They're mostly urine, some saliva, some stool tests, some blood tests as well. And so from those results, we develop a personalized functional nutrition plan that is focused on the root cause. So we're not trying to band-aid anything. We're trying to figure out where their chemistry is going wrong and give the body what it needs to fix that. And we work with the whole family. We want it to make sense for everybody. We know that the difficulties that a complex kid is having affects the whole family. So, all right. So what did we cover this year? Some main topics. We covered a lot of stuff, especially in the blogs. So I want to make sure that you are aware that we have kind of a sister website called thewhymatters.net, and I'm putting it in the chat box for you. This is where we house all of our blogs. I write 2 blogs per month. We also host all of these webinar replays as well. And so you can go there and find all sorts of information about everything you can imagine when it comes to complex kids. So if you've missed any of the webinars or you've missed any of the blogs, you can easily go back and look at that. We also have a YouTube channel where we host all the videos that we do as well. So we covered this year what I like to call metabolic stability. So making sure that kids don't have significant deficiencies. We want to make sure that their mitochondrial function is where it needs to be, because without those basic nutrients, chemistry can't work the way it should. We've also talked a lot about cholesterol, that kids with complex needs tend to have low cholesterol, and that cholesterol is good. It is not bad. Our body makes it. We get it from food. We're supposed to have it. And it's absolutely critical for kids' brain development, for behavior, for health. We talked a lot about the intestine and the microbiome. We talked a lot about immune dysfunction, including PANS and PANDAS. We talked about oxidative stress. We talked about food allergies and sensitivities, as well as oral restrictions and airway. So talking about things like tongue tie, lip tie, and how that affects airway and behavior. So let's cover the metabolic foundations first. So what we know is that most complex kids, and even kids who don't have an overt diagnosis, they're just struggling a bit, they almost all have significant nutrient deficiencies. So we have a test that we do very consistently called the metabolomics. It's a urine test, and it will give a read on exactly what deficiencies the child has and how severe they are. And almost all the time, I'm not sure I can think of even one kid who's had a completely clear test on this particular section. Most kids, their antioxidants, their B vitamins, their minerals and or their fatty acids, their omega-3s, 6, 7s, and 9s, tend to be very low. And so this can contribute to what we call mitochondrial dysfunction. So inside the cell, we have an organelle called the mitochondria. Inside that organelle, the mitochondria, happens a very important process called the Krebs cycle. This is how we make cellular energy. Most kids who are complex do not do the Krebs cycle very well. They have very significant mitochondrial dysfunction. And when you have mitochondrial dysfunction, this impacts higher level things like your immune function, like detoxification, digestion, sleep, behavior, brain development, all of that. And so what we see is that these kids are like cars running on fumes. They just don't have enough energy to do the basic biochemical processes that are required. And if you're interested in more information on mitochondrial dysfunction, I mean, it's kind of a hot topic right now, but you can go to the whymatters.net, and there are a couple of different webinars specifically about that. All right, so some additional metabolic things. So most complex kids have very unstable blood glucose. Sometimes their blood glucose is sort of up and down. It tends to be on the low side. Sometimes it's an insulin resistance situation. And, you think about insulin resistance more in older people, in adults, but it's actually pretty common in complex kids. Almost all of these kids have very low levels of vitamin D. Almost all have low levels of omega-3s. Many of them have low iron as well. And what I see very consistently across complex kids is they almost always have a triad. So they have low vitamin D, they have low omega-3s, and they have low cholesterol. So when we test this and we figure this out and we correct it, it's uncanny, the changes that we see in most kids. So again, cholesterol is good. We love cholesterol. Most complex kids have very low levels. So ideally, the total cholesterol level should be 200 to 225. I have seen kids with cholesterols in the 80s or the low 100s. It is necessary for hormones, for brain development, for myelin that covers your nerve cells, and to make neurotransmitters. So when kids have low cholesterol, this promotes very difficult behavior. Sometimes their behavior can look psychiatric if their levels are low enough. So again, the ideal total cholesterol is 200 to 225. The gut and the microbiome. So these are kids who really struggle with digestion. They often have intestinal malabsorption, and the same urine test that I talked about, the metabolomics, gives us a view of what's going on in the intestine. So it rates their level of malabsorption. And then it will also tell us if there is a yeast or a bacterial overgrowth. That's also called dysbiosis. This is super common in kids to have yeast overgrowing, bacteria overgrowing, and sometimes both. We see a lot of maldigestion. So parents will often say they see undigested food in their bowel movements. They're just not very good digesters. Often they have low digestive enzymes. They have low hydrochloric acid in the stomach. And in particular, we see very poor fat digestion. And so these are also kids who really struggle with their poops. So kids are constipated, they have diarrhea. Sometimes they have both. They alternate between constipation and diarrhea. And I'll tell you, constipation can be for many kids, a major trigger for behavior. So the less they poop, the worse their behavior gets. And so getting their bowel movement straightened out is always, a real priority for us. We also see a lot of what we call toxic metabolites in the intestine. And then we also see very frequently histamine overload. So these are kids who just don't manage histamine very well. Histamine is part of our system. It's supposed to be there. It has a job, but sometimes kids just don't have the chemical pathways to manage their histamine very well. And high histamine can impact behavior. So in terms of, what helps with kids with struggling digestion, we really like to test. So the metabolomics, the organic acids test, the comprehensive stool analysis all help us understand what's happening so that we can be very specific about how we intervene there. Digestive enzymes are generally very helpful. Most kids need them. Not all, but the metabolomics will tell us that. So will a stool test. Probiotics generally are helpful. Intestinal healing supports. So there are several products that I really like that are a blend of amino acids and herbs that are going to heal the lining of the intestine, reduce the malabsorption, reduce the intestinal permeability. They don't always taste great, which is a kind of a drawback, but very, very important because these intestinal healing supports really help probiotics dig in there and do their job more effectively. We also do a lot of food allergy and sensitivity testing. It's important to understand very specifically what a child is reacting to and what sort of reaction it is. So remember that food allergies are an immune system response. They generally show themselves pretty overtly and quickly after exposure. Sensitivities are more of a digestive system response and can take up to 3 days to show any sort of symptoms, which makes it very hard to pin down what is causing those symptoms. Antimicrobials are pretty helpful. I use a lot of things like olive leaf, biocidin, things like that will reduce the levels of the things we don't want overgrowing, like yeast and bacteria. And then for many, many kids, removing dyes, additives, and preservatives is a big deal for them. There are just so many dyes and preservatives in our food. It's unbelievable. So many kids are highly reactive to dyes, in particular, red and yellow. All right, we've also talked a lot about PANS and PANDAS over this year. And so the big picture when it comes to PANS and PANDAS is, number one, it's underdiagnosed. Many kids end up with this long laundry list of diagnoses. So things like, oppositional defiant disorder, reactive attachment disorder, PDA, pathological demand avoidance. A lot of times they're diagnosed with psychiatric illnesses as well, or tic disorders. And so what I really try to communicate, especially when I'm doing trainings for other doctors, is that if a child has a long list of diagnoses, we have to do a workup for PANS PANDAS. We just have to, because we want to make sure that we've identified and targeted the right thing. Physicians definitely need more training. There are not very many PANDAS and PANS literate doctors in the area. There just aren't. And, doctors are overwhelmed and busy, and it's hard to dig into a new specialty. And also, these are very intense cases. They take a lot of time and care. So we definitely need to train more doctors. And remember that strep is not the only trigger. So if the trigger is strep, we call it PANDAS. If it is a different trigger other than strep, we call it PANS. So those other triggers can be different infections. So a different bacteria like Klebsiella, like staph. It can be other viruses as well. So what I commonly see is Epstein-Barr. I see a lot of HHV6. I see a lot of COVID and flu. The other more common bacteria that we see is Mycoplasma. So that's a bacteria that would give us walking pneumonia. And it's hot right now. We're seeing lots and lots of kids with Mycoplasma right now. It's the second most common cause of PANS. So that's something we very consistently test for. And sometimes the PANS can be triggered by something environmental or metabolic. So we see lots of kids triggered by mold. so mold exposure in the home or at school. And we see a fair number of kids who see an acute change in behavior after they've been sedated. So anesthesia can be a metabolic trigger. So these infections and inflammation can cause behavior that looks psychiatric. It can look like a tic disorder. It can look like Tourette's. It can look like schizophrenia in some kids. So a lot of the behaviors are scary, they're troubling, and can look psychiatric. So just to give you a refresher on the warning signs of PANS and PANDAS, it's an acute onset of symptoms, but we can't get too hung up in the word acute because sometimes we miss the acute window. Sometimes kids can compensate, sometimes they hide their symptoms. And so parents aren't really aware of an acute onset that has happened. We generally will see there are just so many symptoms, but I tried to pull out the big ones for you. Anxiety. So an acute onset of anxiety that can also include separation anxiety. So being unable to separate from parents, siblings, whoever it might be. Also an acute onset of bedwetting or other urinary changes. So a kid who's, potty trained, dry at night, suddenly starts wetting the bed or suddenly starts wetting or pooping in their pants. Sometimes we won't see that loss of urine control as in bedwetting. We will see things like they feel like they have to go to the bathroom every few minutes. So they're very frequently going to the bathroom, or the volume of urine has increased, or feeling like it's urgent, that they have to get to the bathroom right now, and then not very much happens. So any sort of change in urine habits are definitely things we need to pay attention to. We also see compulsive behaviors. We see obsessive and intrusive thoughts, and then regressions. So we will often see a behavioral regression. So kids will maybe start baby talking. They'll start playing with immature toys. And we frequently see academic regression as well. So these are kids who often lose math or handwriting skills. Those are the most common things that we see, but we also see sometimes a loss of reading skills, a loss of executive functioning skills. So kids who were, solid students now suddenly look almost like they have ADD or ADHD. We will often see motor and or vocal tics. So it might be, a shrug or a blink. It might also be things like throat clearing, sniffing, snorting. And often the location of the tic will give us clues about where the infection is. So if I see a kid who's throat clearing or coughing in a tic-like fashion, I'm really paying a lot of attention to the throat and, doing strep tests, doing rapid swabs, things like that. Also, an acute onset of stuttering is often one of the first signs. So lots of kids I have, parents will tell me that, they're just out of the blue, they started stuttering. Phobias. So kids will develop a fear of any number of things, but some common ones are a fear of water, a fear of wind, and sometimes it's just maybe a fear of their food getting contaminated, maybe their hands are dirty. And sometimes those fears about contamination will lead to kids restricting what they eat. So restrictive eating can be a big sign too, as well as dramatic mood swings. Okay, food allergies and sensitivities. So knowing what they are is crucial. So again, most kids are very reactive to food dyes. Gluten and dairy are often allergies, and they will, even if they're not an allergy, they promote inflammation. Food preservatives are also inflammatory, so eating clean whole foods is critical. I feel like my slides are out of order, so just, keep up. It's fine. It's Friday. All right. So oral restrictions and airway. So oral restrictions. So I'm talking about a lip tie, a tongue tie, and what we call buccal ties. So you've got frenulum inside your cheeks here and here. And so if a child has a restricted frenulum in any of those areas, it can impact nasal breathing, sleep, focus and attention, and of course, speech and cranial nerve function. And so if a child is not breathing consistently through their nose, they are under oxygenated. It affects their nervous system function. If a child has open mouth breathing consistently, even if it's only at night, it definitely impacts their facial development and structure. It affects their sleep. It affects food allergies and sensitivities. And so what we see is that many behavioral issues start as airway issues. So snoring is not cute. If you've got a child or you know a child who snores at night, it means that they need more oxygen and they need an assessment of their airway. It's tongue ties are a big thing. Every infant should be screened by a qualified, experienced person for oral restrictions because it affects everything from day one: feeding, sleep, all of it. So it is a very common thing, but it's not a fad. It's legitimate for sure. And so one of the things I like to explain to parents is, while we are doing all the right things, sometimes kids get worse before they get better. There are lots of reasons for this, but sometimes it's a detox traffic jam. These are kids who do not detoxify very well as a general rule. And so when we start normalizing some of their chemistry, they're finally, able to move toxins away, and that can be a little bit of a log jam. So we pay special attention to detoxification. Sometimes labs look worse before they look better. It is something I absolutely expect, especially from Pandas kids. Sometimes it's a nervous system recalibration, right? These are kids who've lived in fight or flight for a really long time. And as we sort of change their nervous system function, we improve their health. It can take a minute for kids to find their way. And so healing is not linear for all kids. It's not just a perfect upward trajectory. Sometimes it's a little bit up and down, and that's okay. It's something we expect. So for those of you who may be new to us, or you maybe aren't yet patients, if you're ready to kind of see what we're all about, you can definitely schedule a new patient consultation. We're always taking new patients. There are 2 of us here who do the complex kids work. It's myself, and I have personally trained Dr. Lacey Mays. She's very, very competent and is also taking new patients. It's always a great idea to have your kid adjusted. So all 3 of the doctors here, Dr. Lacey Mays, Dr. Maddie Lehman, and myself, are pediatric trained chiropractors. So we can care for newborns, all the way up. Getting adjusted is really one of the very best ways for nervous system regulation. So again, these are kids who frequently are in fight or flight. That's just where they live most of the time. And getting adjusted really helps change that nervous system response into rest and digest so that kids can regulate and heal. I would encourage you to explore hyperbaric oxygen and our ion cleanse system. So we have an HBOT chamber here. It's a soft-sided chamber. It's very safe. And it's big enough that if your child needed a parent to go into the chamber with them, it's plenty big. It's easily accommodates 2 adults at one time. So with kids, we always expect parents to go with them. So if you want more information on HBOT, definitely Google it. But the pressurized oxygen brings a lot of healing. It's fantastic also to support mitochondrial function as well. And the ion cleanse is a full body detox system that is also fantastic for helping kids transition from fight or flight into rest and digest. Kids who do the ion cleanse, we tend to see improved poops. We see improved sleep and behavior very consistently. So if you're interested in the ion cleanse, go to our YouTube channel at Covenant Wellness, and you'll see that the Facebook Live that I did in November is with the sales director from A Major Difference who manufactures the Ion Cleanse. So that will answer a lot of the questions you might have about Ion Cleanse. The other thing that Ion Cleanse is particularly good at is helping kids and adults who have had a mold exposure. So the Ion Cleanse, I mean, it speeds up that excretion of mold faster than just about anything. So we have lots of families who use the Ion Cleanse when their kid or themselves have had a mold exposure. You should definitely visit the whymatters.net for resources. There's tons of information there that will be helpful for you. You can also visit our YouTube channel. Again, it's at Covenant Wellness. And then I do a webinar every month. I do 2 blogs a month and Facebook Live events every month as well. So lots of resources out there for you to learn about complex kids and, just the ins and outs of what we know about that. So we can help you here. We have lots of ways to help you. So when you bring your complex kid to us, we do a comprehensive evaluation. And that evaluation generally comes in 2 parts. So we do a history with just the parents. So we don't want the child in the room listening to all of their deficits, right? And all their problems and challenges. So we do the history with just the parent, and then we do the exam with the kid at the office. We do very precise precision testing. So we don't do the same thing for every kid. We really tailor it to what their needs are. We do, again, lots of different testing, whether it's the metabolomics that we talked about, which includes an organic acids test. We do a lot of stool tests. We also very frequently do a sinus culture because we're seeing a lot of kids who have either bacteria or fungus that have colonized in the sinuses and creates, quite some challenges. So we have lots of testing options. We do draw a lot of blood. Blood is necessary to find some pretty important things, but we are consistently told how good we are at it. We know how to support kids through a scary experience like that. And most of the time it's a breeze. We also have numbing cream. So we're just, I think, very aware and sensitive to how to make that potentially difficult situation easier for kids and parents. We literally have decades of experience with complex kids. I shouldn't say we, because Dr. Lacey's quite a bit younger than me, but I have been working with complex kids since before I was a chiropractor. So I raised a complex kid. So we know what we're doing. We've seen it all for sure. All right. Now, here's our contact information. So we're here in Jefferson City, Missouri. That's our phone number. You'll see my email, drsonia@covenantwellness.net. You'll find us on all social platforms at Covenant Wellness. And then, of course, don't forget the whymatters.net. You're going to find tons of information there as well. I should mention that we have a pediatrician on staff. And so Covenant Pediatrics is here in the same building. We have Dr. Hannah Strong, who is a DO pediatrician. We do not require families to follow the CDC schedule for vaccines. So if you're having a difficult time finding a pediatrician who will see your child because of your strongly held beliefs, you are welcome here. So right now she does have a waiting list for appointments for new patients. But once you're established with us, we have same-day sick visits for established patients, just lots of services and lots of ways to help your family. So there we go. There was 2025 in a recap in 30 minutes. So lots of resources for you. If there's more you want to learn, it's definitely out there. I am happy to answer emails anytime. And if I'll leave just a couple of seconds here, if you have any questions that you want to ask, I'm happy to answer those. I am finalizing our schedule for 2026 in terms of all of our events. I have forecasted that our next webinar will be on January 9th, 2026. Not sure the topic yet. I'm still finalizing all of that. I usually have it done by now, but it is the way it is. So watch all of our social media platforms for information about all of our next coming up events. And Diane says, "Hi, Dr. Sonia." Aw, thank you. You must know that words are my love language, Diane, because I kind of needed that this morning. So, all right, folks, I hope you have beautiful holidays with your families. And just know that if there's anything you need specific to your complex self, we do see adults too, or your complex kids, we're definitely here to help. So, yeah, thanks for joining me on this Friday morning, and we will see you in 2026.